So neonatal reflexes or primitive reflexes, they are also known as developmental reflexes. They are generally present at birth and they resolve usually over a set period of time. Okay, they appear and resolve in a fairly set period of time. These reflexes, they may reappear later in life due to the presence of some degenerative disorders. Okay, so why are these important? Why do human babies have these reflexes? They are mediated at the brainstem or spinal cord level. Okay, infants, they have certain reflexes that serve them well for attaining some functions for a brief period of time during the development, but then they are integrated by higher centers in the brain. Okay, meaning that they aren't used anymore. Okay, and they resolve in a fairly set time course with maturation of the descending inhibitory projections from the cerebral cortex to the subcortical motor system. Okay, so these are the common or rather the more important neonatal primitive reflexes. First is the Moro reflex, then comes palmar grasp, plantar grasp, ATNR or asymmetric tonic neck reflex, stepping reflex, placing, Landau reflex, Garland's reflex, rooting, and the parachute reflex. Okay, so we'll go into each and just see when they appear, when they are gone, what is the function and how it is elicited. We'll see. So this is the, yes, it is obvious, it is Moro reflex. Okay, it is present starting from the 28th week of gestation to the, and it usually starts from 28 to 32 weeks of gestation, and by 37 weeks it is fully developed. Okay, and it is seen till 5 to 6 months postnatally. Okay, how it is elicited? It is elicited by the sudden dropping of the infant's head in relation to the trunk, which results in the abduction and extension of the infant's arms and opening of the hands by flexion. Okay. An absent Moro, it signifies CNS malformation or HIE stage 3. Unilateral Moro, it signifies either Erb's palsy or that is brachial plexus injury or some clavicle fracture or bone dislocation. Okay. Persistence of Moro reflex even after 6 months of age means either a cerebral palsy-like condition or immaturity of the brain. Next is palmar grasp reflex. Okay, it is usually seen from 28 weeks of gestation, fully developed by 32 weeks, and it is seen till 2 to 3 months postnatally. This is plantar grasp. This is important. Okay, it is seen from 32 weeks onwards to 6 to 9 months postnatally. Okay, the time where it disappears is a bit more variable. Okay, the plantar reflex is well established by 32 weeks and it typically disappears by 6 to 9 months of age. During the normal plantar grasp, you see the direction of the stimulation. Okay, the toes plantar flex. Okay, the toes try to grasp the object that touches its sole. Okay, it seems to flex around the examiner's finger when it is brought across the ball of the foot. Okay, it is not towards the feet, it is downwards towards the ball of the foot. This is ATNR or asymmetrical tonic neck reflex. It is seen in term babies from 37 weeks of age. It is fully developed by 1 month of age and it is seen till 4 months postnatally. Okay. It is characterized by extension of the upper and lower extremities on the side to which the head is turned. Okay. With flexion of the contralateral upper extremity. Okay. Also known as fencing posture. Okay. For our purpose, it can be also be attributed to an archer's pose. Okay, okay. Just like an archer holds his position to actually fire an arrow. Okay, this is the position. Okay, that is somewhat similar to this fencing position also. It appears beginning at 35 weeks, well established by 1 month, and disappears by 3 to 4 months postnatally. Next is infantile stepping response. Okay, the stepping response can be obtained in infants greater than 32 weeks of gestation, elicited by holding the infant in a vertical position with his or her feet in contact with the flat surface. Okay, this initiates a slow alternate stepping action of flexion and extension of the legs. Okay, just as shown in this picture. Okay, this is a very beautiful reflex to elicitancy. Next is placing reflex. Okay. So as the word suggests, it is bringing the anterior aspect of the child's tibia against the edge of a table or rather any surface, any surface. Okay. And the response being the child shifts or lifts its leg onto the table. Okay. Onto the table. And it appears at birth and disappears by 6 weeks. Now this is rooting or sucking reflex. Okay, stroking the infant's cheeks and the infant turns the head to that side and makes sucking motions. Okay, it is usually seen in term babies and it passes till 2 to 3 months postnatally. And finally, Gallant reflex, that is elicited by holding the child in ventral suspension or placed in prone position, and it is performed by running a finger down the paravertebral area of the child's back on one side. Okay, the response swinging of the pelvis to the stimulated side. Okay, that is Gallant's reflex, and it is seen in term babies and it persists till 2 months of age postnatally.